when it comes to adopting AI in healthcare, um, what do you think are the challenges right now that prevents using AI in day-to-day in the hospital or in the clinic by physicians, by nurses?
I think just given that there is the strongest evidence of even randomized clinical trials, controlled trials now, I think it's just getting used to it. I think reimbursement and the sustainability of reimbursement plays a very big role. The data shows that, and hence that paper or that review paper that I wrote, where we so often see that, well, in the case I'm very familiar with this autonomous AI for the diabetic eye exam, which was a big thing when it happened in 2018, when the first time ever FDA approved something like this, where there's no human involved in the medical decision. No doctor, no human. It's only the computer. And people were familiar with AI, physicians were familiar, and especially in radiology, but I use it in my retina specialist practice also. I use AI daily, but it's very assistive. It's still me as a provider, as a doctor, as a specialist, ultimately making the decision and being responsible for that. I just use it as extra inputs. And this was different. This is where there's no human input. And that before people had said, well, AI, yeah, but there's still a doctor in charge, right? And now there's no doctor in charge, does this actually benefit me as a patient? Will it lose to job loss for us physicians or other classes of providers? Is there racial or ethnic bias? Are we actually making things worse rather than better? Who's going to pay for this? What's happening to the data? All these concerns that are always there in a light way were really almost provoked by what happened here in 2018. That's the big thing, liability, right? Who is liable when the AI starts making errors, which is